We didn't pick a fight over tariffs or tanks in Ukraine. We picked one over healthcare. 15 years after the Affordable Care Act, we're still living in its shadow, a country split between those who can afford to get sick and those who pray they don't. And now, once again, Washington has turned health coverage into a hostage situation. Here's the reality, not the rhetoric. If Congress lets the enhanced ACA premium tax credits expire in December, the average marketplace premium for subsidized enrollees can more than double in 2026. Whether the shutdown drama is resolved by the time you hear this podcast or not really doesn't matter. If lawmakers didn't hardwire an extension, the cliff is still there, and families hit it when 2026 rates go live. Meanwhile, the shutdown has already become the longest in U.S. history, with mounting economic damage. This isn't left versus right anymore. It's stability versus fracture, a controlled demolition with patients still in the building. And if that sounds dramatic, spend 5 minutes in a rural emergency department trying to transfer a sick patient who has no coverage to a higher level of care. Welcome to the Secession episode of the Healthcare Nation podcast. Today, Joe and I are going to unpack where we're going and what this situation really is all about. Let's get into it.
Welcome to the Healthcare Nation podcast. We're committed to bringing you thought leaders in the field to discuss what's new and noteworthy in the healthcare sector. Now your host, Rick Giannotto.
Welcome to the Healthcare Nation podcast, here with our producer, Joe Woolworth. Joe, my good friend, how are you doing?
I'm good. I'm doing well.
It is Casual Friday, as you can tell. One of the rare occasions when I am dressed down on a Casual Friday.
In honor of the government shutdown.
In honor of the shutdown. That's it. We're not washing clothes at home. We're trying to, austerity measures across the board. That's it. Right? So, look, we got a lot to talk about today. Really, not only the shutdown, but specifically its implications on healthcare delivery and what's happening there. So I know you got some questions. We had some folks email us with some questions when we queried our subscribers. So what do you got for me? Let's jump in.
I know this is an interesting topic for a lot of people. A lot of people a little scared. We were just chatting before. I was telling you my personal healthcare insurance went up to like mortgage level, it seems like. So I know a lot of people are curious about this topic. So give us a short history. How did we get here?
And I'm sorry to hear that, of course, because this is the real thing. But look, I'll give you the short, uncomfortable history, if I could characterize it that way. First, look, both parties built this system. And, we try to be very objective here on the show. I'm going to just say that. But both broke it, I think, as well, maybe in different ways. Let's start with the Democrats. Look, you consider them the architects of access when it comes to the Affordable Care Act. Right? Guaranteed issues for folks, federal exchanges, Medicaid expansion across the board, income-based subsidies. Yes, they cut the uninsured roughly in half when you look at the U.S. if you go back in time. And look, I could be corrected, but I think my numbers are probably fairly up to date. They expanded coverage without expanding capacity. That's my opinion. And I think that's the problematic piece of it, right? And there may have been some assumption here that regulation could replace some of the necessities like throughput, but it couldn't. The results, affordability, yes, but maybe more on paper than not when you think about it. And some of that's coming to roost. So if I was going to sum it up on the Democratic side, they supercharged the Affordable Care Act with enhanced tax credits through the American Rescue Plan with Biden, the Inflation Reduction Act. They didn't reduce, though, the costs overall. They just shifted them. So the federal government picked up the difference, right? The delta between what care actually costs and what households, and you just gave an example, can afford.
At the same time, did healthcare prices go up for care?
Across the board. Labor, the cost of the infrastructure per unit cost. I hate to characterize individuals or patients like that, but they all went up.
Sure.
So those moves, though, did stabilize premiums, but it didn't bend the curve. And that's exactly to your point, didn't bend that cost curve. Now, if I switch to the Republican side, look, this is an opposition, but without a replacement, right? Is there any good ideas coming out? Not that I've seen. The repeal and replace became identity politics. Let's go back to 2017. We all remembered, what went down at that particular time. And I think the unfortunate thing for the Republicans is it branded them as reckless with coverage. And that did not go through this skinny repeal process. It probably shifted, though, this ideological kind of, perspective that I believe folks were going through with healthcare as a right, et cetera, to one that was more arithmetic, right? More mathematically based. Washington cannot subsidize an unreformed, inefficient market, right? I think that's where the Republicans are coming from.
Yeah.
If I was going to sum up that side, though, and this is my opinion, not based on, let's say, data, I think they're looking and what they see is a fiscal time bomb. There's roughly 25 to 30 billion a year in new federal outlays. Let's just say 300 billion over 10 years. If this extends, right, and extends this artificial affordability, some price support system for an unreformed, unreformed market, their argument is it just props up an inefficient system, blunts competition, and deepens dependency on Washington.
Sure.
So put those two perspectives together, and the real fight, and you said it a minute ago, it's that each unit of healthcare now carries stacked costs, right? They're built in. Everything from labor, facilities, administration, drugs, risk management, and the reality check here is you can't austerity your way out of these innovative things you need to put in place, and you can't subsidize your way to sustainability. So, long-winded answer there, but I think probably covered a lot of points there.
Is there also, I think I remember reading somewhere or hearing somewhere the acceptability or the change in public perception of mental health and more people using mental health as part of their healthcare costs also driving up. Or is that more of an insurance thing that I'm thinking about?
Yeah, look, mental health is always baked into the equation. The reality is, I think that whether you look at commercial insurance or even some elements of Medicare and certainly Medicaid, right, 3 different products, if I could, again, put it that way,
right.
None of them are doing the job they should with respect to mental health or even looking at mental health on parity with, say, something like a clinical condition like diabetes or heart failure.
Okay.
So is it driving up costs? I think there's more recognition of it. But what we're seeing in the private markets is things like BetterHelp and these apps that are trying to address mental health issues on, I would say, a more entrepreneurial, innovative way.
Sure.
But by and large, they're not covered by insurance.
So now that you kind of set the table of today's topic, we've got like a magic trick gone wrong where somebody tries to pull the cloth out from the table and leave all the stuff, but all the stuff seems to be flying here because we got this big government shutdown going on.
It is flying. And, we've got some updates on what's happening, but as of what we know right now, Friday, right, November 7th, it's still shut down.
Yep.
We know that that's happening.
And are we in record territory?
We're in record territory. It's never happened before. This is, I think, the longest shutdown ever on record.
I think right now, primarily the news cycle today, the last couple of days has been impact to airports, TSA.
Big time.
Yeah.
Big time, right?
Thousands of flights. I just read it on the way.
Would not want to be traveling right now.
Rough.
That's a reality.
And so what's the impact? Let's talk about the healthcare side of it. Wow. What's really at stake here with the government shutdown and its impact on healthcare?
Yeah, I think why is this shutdown different? It's kind of a subsidy cliff detonator. We'll use that explosive kind of example. Let's get into the math. I mentioned that a second ago, not the theatrics here. If the enhanced credits expire at the end of the year, right, then average marketplace payments go up over 100%. So a plan that was $800 could go up to $1,800. That's a reality. Some folks will see things in between, but I think you mentioned it earlier about your personal experience. When it hits your pocketbook, right, for millions of working families, that's like a market eviction, right? It's not pleasant. And
and I've heard it said that kind of is a move in policy and stuff, like once it hits people's pocketbooks, but I think in the past we didn't have so much identity politics, and I'm wondering if that's going to change. Because in the past, I think you could say like, okay, once it hits the pocketbooks, all of a sudden everybody's on the same team.
Great point. 75% of Americans, including many Republicans and certainly Democrats in there, they support extending the tax credits. Voters in this case, they're not seeing this as a partisan issue. It's more of a pocketbook and a coverage issue, right? It's about their own healthcare stability. So they want it fixed.
Yeah, I agree. I think that's right. 75%, there's no way. We're pretty 50-50 at most things politically.
Yeah, absolutely. I mean, and look, the coverage loss, it could impact 4 to 5 million people. And there's a job component to this as well
Right.
that will ripple across from, obviously the impact to the federal government. We're in a shutdown, but also at the state level too.
Yeah. So as public, perception starts to change, it usually changes a lot faster than policy,
Right.
So it can feel a little bit slow with that. So, you've called this a healthcare secession. What do you mean when you say healthcare secession?
Yeah. Let me break that down just so we don't scare anyone on there and I don't get censored by YouTube. Which
you're not saying there's going to be different healthcare for Republicans and Democrats.
I don't know. There many would argue there's already different healthcare for a lot of folks out there. But I would say this: there's a fracture line, right? If we just take a look at states that expanded Medicaid or didn't, right? So non-expansion states still rely heavily on the marketplace for individuals there, right? And the loss of federal subsidies with no backup layer, they could very well be the first states, and they're primarily red states, that get really impacted, meaning their constituents, the populations of those states. So that's a reality. Blue states, on the other hand, let's take California, they could wrap subsidies so that they could, insulate themselves. So when I think about a secession in this sense, I'm thinking about, let's envision two kind of constructs within America with respect to coverage. One that is very cushioned. We'll say California expands wraparound so that Medi-Cal or the marketplace has state-assisted subsidies. And the others, they're exposed, right?
Okay.
So you get those premium increases.
So, you were talking about in the history how we got here. Here's what both parties contributed, and then here's both parties also kind of blew it a little bit. So who failed and how? Because I think this is what the pundits want to do. They want to play the blame game. And, you certainly hear it's what's holding up the shutdown. You've heard the president himself say, over and over again, it's clearly the Democrats. That's all their fault. It's all their fault. There's usually the truth is somewhere in the middle.
Yeah. So and look, and I think here on the show, you and I have always been in the middle, right? We try to be very objective. Let's break it down, right? Let's do a brand autopsy, right?
Okay.
Dems and GOP, right? And both of them, first of all, they blew the brief. Both definitely did. But I think if I was going to get back to each one individually, the Democrats, they won the coverage side early on, but they lost the delivery piece, right? It's not sustainable. We're seeing this right now. Subsidies and expansion without capacity, infrastructure still creates issues with bottlenecks, payments, reimbursements. The system is very compassionate on paper, but it's probably exhausted in practice, right? Fiscally, and even I would say from a labor component, and the folks who are in healthcare in that sense as well. Mm-hmm. It's just a reality. On the GOP side, right, the Republican side, we've seen a decade of repeal rhetoric. We've seen this again back to 2017. No replacement blueprint being put forward. In 17, there was the skinny repeal, but it collapsed, right? Yeah. And that caused a lot of brand damage, I think, for the GOP. They're preaching discipline, but they need to come forth with a new program, right? A new delivery system. That's what I think. And if we get down to individuals, voters, folks like you and the vignette that you shared about your personal experience with the premiums going up, everyone wants lower premiums, right? And they want stability. They don't really care who signs this, whose signature is there on the law. That's not the reality. They want it done. And right now, I think at the end of the day, Democrats can't manage it at scale, and Republicans, they need to come forth with something new that's also got the compassion piece put in it. And right now, what it looks like is bureaucracy at war with itself. That's the shutdown.
Yeah. And I think for people that kind of get sick of the rhetoric side of the conversation, that's how we got here, right? Because it feels like it's just talk. But okay, how do we fix it?
Yeah.
Yeah, it's a problem, right?
Yeah,
I agree. It's a big problem. Both sides agree. It's a big problem coming at it from slightly different angles. So what can the deal look like? If you were in the room cutting the deal, what would it look like? What makes sense? Because obviously it needs to change. It's unsustainable. So there's elements of that's very correct. And it also from the standpoint of we look at other countries and we look at their healthcare, and there's kind of like this starry-eyed gaze that that would be nice that Americans have about like, what's that like?
Right. Yeah.
You know?
Well, the other side of that is be careful what you wish for. But look, first thing, hot off the press in terms of like one of my first points, apparently Minority Leader Chuck Schumer is going to try to connect, in a session with Republicans to try to end the shutdown and ask for a 1-year extension of the ACA tax credits that are expiring. Right?
Okay.
I don't know if that's true or not, but it came off the wire, so I'm just communicating that. And
usually kind of a first step after a shutdown, huh? We're giving ourselves a little bit of time.
Yeah. And in the world of things that I would want the deal to look like and starting with extending the credits, yes, I would say you got to extend them for 2 to 3 years, align with the 2026 filings. No pricing on uncertainty. We need that, right? There's too much instability, and I think there's a political connotation that we might talk about. The second thing is, you've got to protect middle class affordability, right? The eligibility, federal poverty level percentages, cap the benchmarks, premiums. We've got to revisit there. The other three, I think, are really tied more towards delivery and innovation, right? We've got to think about the structure, right? Is our workforce, prepared to deal with, this type of reimbursement, wobbly kind of boomeranging around? It's not fair to folks who predictably, if you're a physician, have your own practice. How do you figure this out?
Yeah.
And the insurers are, they're losing folks year to year. There's no continuity in any kind of managed care plans that, say, a big insurer in a state wants to do from, year to year, because their constituents, the folks who are on their plans, may be on another plan next year. So why should they invest in it? And that's my take. The other side is, the Medicaid side. We got to repair the churn, because a lot of folks, this issue with redetermination, disenrollment has created a big issue there. And finally, and we've always been very bullish on this, we've got to protect the innovation side of care delivery and the research engine. It doesn't play a direct part in this, but we've got to keep looking at ways that we keep innovation in the system. Otherwise, this is going to come back to haunt us again, because there's no imaginary savings from any kind of fantasy utilization. We've got to have something really created. There's no coverage swaps that dump costs back on hospitals. Hospitals cannot handle that given their margins collectively. And we can't have these kind of political gotcha games back and forth, masquerading as reform.
And they almost feel like a little bit more than gotcha games right now, in that like both people are just like, cool, I'll take my ball and go home. Like, we're not fixing anything if you guys don't even come to work, and it's your job to fix the thing.
Yeah.
That can make it a little challenging.
Yeah. And, speaking of work, entrepreneurs, small business owners, folks who have their own insurance that they have to get either in the marketplace or through some other vehicle, such as yourself. I mean, you get impacted by this, and it's a big number, particularly if you've got not only your family, but employees you have to deal with.
Right. And when I get frustrated with health insurance, I can't take a month off because I don't like the way it's going.
Yeah. That's right.
I still got to go earn money so I can pay my bill.
That's reality, right? And that's it. I hear you.
So all this happens to be happening right in the midterm of the 2026 midterm. It's kind of a boomerang. Depends on what news flavor you listen to.
Yeah.
But it seems like we just had a good midterm election. Some bellwether stuff, maybe some very predictable stuff.
Right. And good, of course, good always depends upon what side of the aisle you're on. But I would say this.
Yeah.
It's good that folks went out there and voted.
Record numbers.
Yeah. And if you do look at what I just mentioned with respect to, Chuck Schumer and trying to go back to the table with the GOP and maybe look for an extension on the subsidies and credits, that's all because I think there is a belief on the Dem side that they did well and they've got some some leverage here, right? It could have gone the other way too. So we don't know, but I would boil it down to this: when you think about the midterms and just everything that's happening, there are still flashpoint states, right? There's these high marketplace non-expansion states I mentioned earlier with respect to Medicaid and everything that I think is probably more polarized on the, right versus left side that are going to get hit here. Thin safety nets, lots of exposure. There's visible pain that whether you believe the elections went well or not, that individuals are facing because there's still these double to triple digit increases that folks have to deal with. We can't say, or I can't say that it's hit hospitals right now, but it is ultimately going to impact hospital reimbursement. And if you don't have coverage, you go to the emergency department, throughput, everything that goes along those lines. So I think if you look from a timing perspective, it's a brutal time depending upon what side of the aisle you're on. Whether you see this issue, as you said, as a bellwether, healthcare is definitely going to be front and center. And who's left holding that issue as the party that didn't do anything about it? That is what the voters are going to determine when they go, right now and as we move forward into 2026.
Which an election cycle is always the thing, right? Whatever party's in power, the other side likes to run on how inefficient they've been in fixing one of the main issues that hits the pocketbook.
Yeah.
And so, I mean, that's pretty normal. But at the same time, I heard something like most people might get a 40% increase, which, I don't remember where I heard that, so don't quote me on it. But that's significant. That's not like matching inflation.
But my numbers are up 100%. So look, from an election I think if I could forecast this, and some of it's already been done, we saw this in Virginia and New Jersey, certainly at the governor's side, a boil over at the state level, state houses and governor races, right? Coverage loss for the average American equals economic pain in real time. This is something. It's not like, the price of eggs are going up. This is year to year, your premiums are going up. This impacts everything for the average, American. And don't forget here, we're talking about people's health. So those who have chronic conditions depend upon the system to help them stay in a state of optimal health. When you have a price tag tied to that, it is more than stressful. I think I think we can agree on that. Yeah,
most people's budgets don't have an extra $400 to $1,000 a month built in to absorb the pain of unexpected rate hikes.
Right, you've got it. Yeah.
So moving forward, kind of talk some rules of engagement here. It feels like, at least the way you hear people report on it, that we're in a healthcare kind of a war. Every war ends with rules for peace. So I think that's what kind of people are hoping for. Great. Let's have a plan. Let's have something going on. Yeah. What's the peace plan look like?
Yeah. Let's bring the Axis and the allies together, right? And bring them to have a conference at Malta.
Or just come to work and talk to each other. That'd be a great first step.
That would be a great first step. Look, in no particular order. And again, so much of this podcast really, I think, leans a lot on innovation and forward thinking. Models of care and private-public partnerships. And I think first thing is, can we govern at the speed of business? I think that would make a big difference. And what do I mean by that? Healthcare moves in quarters, sometimes, years, not decades. And when you have a system that has these regulatory components that slows things down, so, innovation slows, it can have a suffocating effect. And we've really got to be mindful about that. And, I always think if Wall Street can approve a financial algorithm in, a couple of weeks, we should be able to do the same in healthcare policy. Yeah. The stakes are, I would think higher, right? So that's just one thought. Second is, we've got to stop lighting the candle at both ends. And what do I mean by that? We subsidize demand. We got to also look at supply. We've done things during the pandemic, like have licensure reciprocity across states and telehealth. Then we take it away. We've got to get standardized on a lot of what we're doing on the innovation side. And I also think that, and I don't want to be a doomsday person, but all of this is a warning shot, because at the end of the day, the next shock we may have, right? It could be a cyber issue. It could be another pandemic. Could be, you name it, when it comes to an economic, impact to what we're seeing as average Americans and our cost of living. That's not going to wait for a political solution. And when it impacts healthcare, that really can put a strain on the system that could be devastating. We saw what happened with the pandemic. And I'm saying that because we need a resilient system. We need something that's hardwired, that's built for speed. And if a shutdown can create a situation where we've got this, economic angst because premiums are going up, imagine if that, expanded into care delivery itself, and we had closures, shutdowns. I mean, you name it.
Right.
In the opening,
it's frustrating for 2,000 flights to be canceled, but for 200 hospitals to shut down is a different thing.
Right. And in the opening, I mentioned, if you were in a rural hospital and you had a patient in the emergency department that was very sick and you needed to transfer them to an institution that had a higher level of capability to take care of a more acute patient, one of the questions they're going to ask is this an insured patient, right? Because they're already at a facility. We don't want to be in that situation.
Yeah. Yeah, I think you're definitely right. So let me ask you this. I'm thinking in terms of the metaphor of the peace talks, and do you think the right people are going to be asked to be in the room? And let me tell you why, because we made almost a whole episode, didn't talk about AI. So I'll talk about AI for a second.
Yeah.
When we first started seeing them talk about AI in Congress, I think the perception of many was like, ooh, these Congress people don't know. They're not the right people to be setting the policy.
Yeah.
So if you were building the dream team and they were going to work with a group of people, I'm not looking for names, but like what types of people should be weighing in on an actual plan to change it, as opposed to a let's stop doing it your way plan, which feels like what we've got in the last 3 rounds.
Yeah, that's a great question. I'm going to stop short of going into the territory of regulatory capture, because I'm not going to weigh in on things like that. But you've got to have the right people in the room, because if you have the folks in the room who are going to design a system that only benefits them, then they're capturing the market. So we've got to be, we don't
want just Congress people and people who use lobbyists. That's who we don't want, the only two groups of people in the room.
Right. Or let's say an insurance platform that's saying we've got the cure, and then
we're here to fix it.
We're here to fix it.
Also,
so
we're going to do well. All right. We're not going to lie to you.
Well, right. I mean, that's you know it, and their motivations are completely different. So if I was to think about, how do you, first of all, there's got to be a conversation. Mm-hmm. And what's missing in that conversation is taking a real hard and objective look on the health status of most Americans, right? And it's not good compared to other industrialized countries.
Yeah.
And when you have a shutdown, and when you have concern over affordability for insurance coverage, that directly impacts, for some Americans, whether they're going to afford to get their prescription filled. Mm-hmm. And whoa, that's devastating. If you have to choose between groceries or your prescription.
Yeah.
And that's just one example. Right? If you think about what you need to do without, or going underinsured, or having a high deductible, which could wreck you, it's still the leading, cause of bankruptcy in the United States is the, medical bills and the associated hit that an individual can take because they don't have that level of coverage. So it is a big issue, and let's hope this gets resolved. And when we come back, we'll bring everyone up to speed.
Yeah, hopefully everything goes well. Okay, so final word.
Look, a shutdown like this, and we'll use the air traffic control and what's happening with flight delays as a proxy. You would not want that happening, as you noted, in an emergency department. Folks are waiting for surgery. An individual has a chronic condition and needs to see their provider. That's what's at stake when you really extrapolate and think about where an extended shutdown can go. Because healthcare is its own economy, right? The health sector really is its own economy. And it is subject to all the levers that the regular economy is. And when you really shut down certain inputs and outputs that are associated with it, we could have some negative effects that we don't want to see.
Right.
So that's it, my friend. Short episode, but I think an important one, because we want to keep folks up to date on what's going on with the shutdown, how that impacts healthcare. So until next time, Joe.
Till next time.
The opinions expressed by the host and guests are for informational purposes only and not associated with any companies or academic institutions. Please follow us wherever you listen to your podcasts, as well as our YouTube channel, Healthcare Nation Podcast. And if you have any questions or want to contact us, please reach out to healthcarenationpodcast.com.